What kinds of things can we do very practically to deal with situations like obesity, with tobacco, alcohol use, HIV/AIDS, cancer screening, sun screening? What do we do to improve the health of the populations that we care about? That's what this course is all about.
What is unique about it relative to other programs that we may have is that China really is a country that is growing so quickly and is really entering into discussions with nations, with wealthy nations around the world, and I believe is going to become a leader and serves as a model for the political system that they have and the healthcare system that they're able to enact, and the way that they will engage with countries and with communities in reducing health disparities and promoting health is going to be unique.
Most of the rest of the world understands China to be an emerging power, and one of the things that comes with that is an expectation to be involved in the rest of the world. And I think that might be a bit of a new idea for some of the Chinese students. And I think Kate in particular was very much in her teaching trying to say to these students, you know, you are the young generation in China. The rest of the world is actually starting to look to you for leadership. And it's a great opportunity for China to have an influence in the rest of the world, especially, you know, the low-income nations of Africa, Asia, and South America.
There is no any other university have this training program or have this department. This is the first, I think it's the first time in China.
The students they're not all from Peking University. They're from around different parts of China. So it's really, in many ways, the best of the best in China being sent to this program. And I think most of the students understood it to be an honor to be able to participate. And in addition, especially when we went in the summer of 2010, we had some individuals who were policymakers or had very important positions, for example, in the Office of Quarantine Health, who were actually not students in the traditional sense, meaning they were through with their training and they were in the process of being a part of, you know, China's healthcare system, but they were there learning along with everyone else.
Having a classroom full of both policymakers and students is very exciting because we can be thinking about what the policy implications are, what policies would need to change, what that means for government and financing and taxing, and what it means for the health of the community and weighing that balance.
So I wanted to, again, use an example from my work in Kenya on basically why young girls have such a high rate of HIV in a story that you might not have ever thought about before.
And the other thing that is very clear that we bring is the global experience. We have worked around the world in a way that is much broader. The faculty who are working there have done fantastic work really around policy and not so much around working with communities for behavior change. So the experience is not just the experience from being here in the United States and the knowledge that we bring, but it is the experience that we've been able to have in working around the world.
I think our style, just Kate and I and the other folks from the U.S. who went and taught, our style is maybe a little more interactive, a little less based on rote memorization of materials and asking questions that we don't know the answer to.
The students are in the beginning very hesitant to say what they're thinking or to engage with us in a more creative way. But what we also found was that over the period of time being there is that they really opened up. You felt by the end of the week that the students were completely engaged in a way that was good for all of us.
It is an opportunity where Duke has a niche or a foothold to be involved in an important part of the world and to begin to sort of share some of the vision that Duke has for what global health could be and what China's role in that could be. Global health is not just for China to learn how to improve China's situation, but also how China can help, maybe even be a model for how other countries could reform and change their health system.
Duke is one of the top university in US. PKU is one of the top university in China. So I think the collaboration between the two top universities of two countries is a very good beginning.